All right, guys. Well, thank you for joining us today. I know it's a kind of a chilly Friday afternoon here in Austin, so hopefully you're all watching from inside. But for those of you that don't know me, I'm Dr. Jennifer Gordon. I'm a dermatologist here at Westlake Dermatology. We're talking about liposuction versus Coolsculpting today, so permanent fat loss. There we go. So like I said, I'm a board certified dermatologist. I've been here about 10 years now, which is hard to believe. I do both medical and cosmetic dermatology. So we do quite a bit down here. I'm down in the South Austin office, which is just off Davis Lane in Mopac. Okay, so like I mentioned, we're talking about permanent fat removal. So this is fat that is gone from your body for good. The two main ways to do this is with liposuction and Coolsculpting. So they're similar but different. Liposuction, manual removal of those fat cells that are in your body. It is invasive. We have to go in there and get them out. The results are immediate. I put that in quotes because, the fat is gone when you leave the office, but you really don't see the final results for a few months. There is definitely downtime associated with liposuction. You will have some bruising and swelling. Coolsculpting, the differences are how we do permanent fat removal with Coolsculpting is that it freezes the fat cells, and that causes cell death. It's non-invasive, so we do that from the outside. You do have delayed results, so again, about 3 to 6 months to see those final results, but really no downtime. Again, that's going to be in quotes. We'll talk about that when we get to the Coolsculpting section. And again, you can have some bruising and swelling. So first we're going to talk about liposuction. Before I forget, there is a little question Q&A box that you guys can type questions in as we go through this. And there'll be some time at the end of these sections that we can go through them. So feel free to ask away. Okay, so like I mentioned, liposuction is permanent fat removal and it's manual removal of those fat cells from the body. So the way we do it is called tumescent liposuction. Tumescent means that you're awake. Yes, you have drugs that are going to make you feel nice and happy, but you're awake when you're here and you're awake during the procedure. We fill the fat compartment with tumescent fluid, and that fluid contains lidocaine and some other things that help you not feel the procedure as much and make it much more safe than putting you under general anesthesia. After we fill that fat area up with the fluid, we then use cannulas to manually remove the fat cells from that area. Again, you have some downtime after the actual procedure. You're going to have drainage. You're going to be in compression garments. Like I said, the results are immediate, but you really see the final results about 3 to 6 months afterwards. So this is kind of an image of filling that area with the numbing fluid. So you can kind of see here that we've marked the area, and then the fluid is going into that fat area. That helps us get into that compartment safely, and it also helps you not feel the procedure as much. After that, we go in with cannulas, and those cannulas are what allow us to really manually extract that fat. So every patient I've had always has said, wow, this is much more invasive, harder to do for you than I thought it was going to be, because they see you just kind of going in there with your shoulder and elbow. But so it is a little bit of a workout for us, but that's how we get all of that fat out of there for you. So everyone always asks what's the difference between lipo and Smartlipo. So Smartlipo is where we actually use the Smartlipo laser prior or after liposuction itself. So this laser is what gives us skin tightening, and it also helps emulsify the fat and smooth that area so it's easier to get a lot of that fat out. This is still liposuction at the end of the day, though. So we are still manually going in there and removing that fat. So it's just adding that laser to the liposuction procedure. Okay, so here you can kind of see what we do with the laser. It's that same compartment of fat. So after we've put that tumescent fluid in, we go in with the laser and we target that top layer of skin and the fat itself, which makes my job easier, but also helps with skin tightening after the procedure. Okay, so about the recovery. So I tell everybody you're going to hate me for a few days. So you are sore, you are draining, and you're in this compression and you're just wet. You just have to know that that's what you're going to expect for a couple days. Those first couple days are the worst. The pain gets a lot better after that, and you stop draining usually within 72 hours. After that, you kind of go through a little phase of really seeing your contour. But then about 2 weeks after the procedure, you go through this little delayed swelling episode. And what happens there is that's just your body healing. And so you start to feel kind of more like firm and not like nodular and almost swollen again. And that's just your body healing up. During that time, lymphatic massages are really handy to do. I have a slide on that coming up. But after you kind of go through that peak, within about 3 months, you're really going to start to see those final results. And most people say it's very worth it. All right, so here are a few photos just of patients that we've had, because we all just like to look at photos. So this was an upper and lower abdomen that we did. Here again is an upper and lower abdomen. And here's the side view. And here's where we did an upper lower abdomen, but waist and flanks as well. So you can really see at the back how she got a nice kind of almost, you know, hourglass figure with those waist and flanks. And then again, here's an abdomen from the side. And then we also did her bra back. That bra back is just a horrible place for a lot of women. Everything just hangs over it, but you can see here how nice you can get that contour with liposuction. Here's again waist and flanks as well as bra back. She's got a really nice shape. And here we did abdomen, but you can see on the back the bra back, waist and flanks again. Again, just a great shape that she got. Here's another one we did, which was abdomen, bra back, waist and flanks. Another kind of all the way around abdomen, waist, flanks, and bra back. You can see here she got really good skin tightening too. That's one thing that we can never guarantee is how well that skin will contract after surgery. But again, when you're doing the laser and doing those lymphatic massages, wearing your compression, there's a great product as well that I'll show you. Those can all help with the skin tightening. And again, someone you look at and you say, you don't need liposuction at all, but if there's a little bit of fat in there that you don't like, get it out. Here's the side view. Neck is one of my favorite ones to do. I think the neck can make such a difference for people. And the nice part about the neck is not only can we get the fat that's right underneath the chin here, but you come all the way around this whole jawline. So you can really get a very chiseled jawline for people. And even people that don't have a lot of fat on the sides of the neck, doing a lot of that laser under here can really shape this area. And it's such a game changer for a lot of people. So you can even see from the front how well defined that neck is. And it's not just for women. Men, we do a lot of men. Of course, you have to think of kind of different shapes that men like compared to women. We don't necessarily want to give men a super hourglass figure. They like more of a straight down look, but even subtle changes can make a really big difference. Here's the waist and flanks from the side. There's another abdomen. Ended up with a tiny little waist. Men too, so gynecomastia and increased breast size in men really can be bothersome too, so it's a great option for that. So this gentleman was very bothered by his breast size, and so we reduced that with liposuction. Got a great result for him. Okay, so that's the quick version of liposuction. Questions at all? Do we have any that popped up in the Q&A?
I don't see any currently, but feel free to pop in that question and answer box if y'all do have any.
Perfect. All right, we'll move ahead. Okay, so on to Coolsculpting. All right, so like I said, Coolsculpting is freezing a fat to make it undergo cell death. So that is called cryolipolysis, and that's the destruction of fat cells through freezing. Downtime is minimal. Again, remember my quote. So you will be sore after Coolsculpting. You'll be numb and might have some bruising and swelling, which is minimal, but there's really no restrictions after Coolsculpting compared to liposuction. So in a way, it's almost no downtime. Again, results are generally seen a few months after the treatment, and in some areas you do need more than one treatment to really get your optimal results. The difference and the tough part about Coolsculpting compared to liposuction is lipo we can get, any little pocket of fat we can get at. Coolsculpting we are limited by the tips themselves. So there's small tips, there's big tips, there's tiny tips, but we have to be able to get that tip fit on the fat area that you want. We're very good at it, but there are some places that just don't quite fit. Okay, so kind of the quick version of how this actually works. So like we all know, your body has a fixed number of fat cells. Those fat cells get bigger or smaller depending on, gaining weight. And so Coolsculpting works by actually we protect the skin itself, but it cools the area that the tip is on down to a certain level where it causes that fat cell to undergo programmed cell death. And so those cells kind of die over a few weeks, and then over a few months, your body cleans out those dead fat cells. People always ask, do you get increased lipidemia, which is just increased fat in your blood or anything like that? They've looked at it, and apparently you don't. You just pee it out. All right, and so each tip, so what happens with Coolsculpting is we put this vacuum suction tip on an area of fat, and that sucks up that area of fat. And within that area of fat that's in the Coolsculpting machine, with each treatment, you get about 25% of those fat cells to die. So that's about a quarter of all the fat that's sucked up. So that's a good ratio. And this photo kind of shows that. So you have the original, all your fat cells. After Coolsculpting, all those blue ones are undergoing death. They get cleaned out after a few weeks to months, and then you're left with about 75 or so % of the fat that's still there. And again, like I said, you can always retreat that fat. Does not harm the fat that's still left over. Where can use Coolsculpt? About anywhere we can get a tip. So, the most common areas are obviously abdomen. We can do the chin as well with Coolsculpting. Arms are really popular. Inner thighs are really popular. Waist and flanks, obviously, but there's little places like the knees that you can do and all sorts of stuff. So if we can fit a tip on it, we can get rid of fat. Okay, so this is what treatment kind of looks like. So this is the little device that goes on. And it's, like I said, it sucks up that fat and then it starts to get cold. And just about when you think you can't take any more, you can't get any colder, you go numb. And then you just have to kind of sit through the treatment. If we're lucky, we can get 2 tips on you at the same time. Each tip is about 35 to 45 minutes, depending on which one we're doing. And like I said, you can do multiple sites at the same time. We can overlap while you're in the office. You can do multiple treatments in a day. So it just kind of depends on what our goals are and how much time you've got. We used to repeat treatments in certain areas we knew we needed to do twice. Same day. We typically wait about a month now to do that, but you can wait a full 3 months, see how your results are, and then do it again if you want to. Okay, so immediately post-treatment, this is what it looks like when we take that vacuum suction off. It looks like a frozen stick of butter. So that's kind of funny. And then the next part is where we have to massage that frozen stick of butter down. This is where you have to grin and bear it a little bit for about 2 minutes. So this is a little bit spicy, but it's one of the most important parts of Coolsculpting. So this really breaks up those fat cells and can really help with how much fat you get to permanently go away. And here, this is from Coolsculpting themselves, but these are some photos of some of the most common places that they do and kind of how they put the tips on. So you can see in the upper left, that's a really nice abdomen, waist and flanks below it. Again, a male abdomen below that, and then on the other side, abdomen, but put in a different way. So it doesn't have to be the same for everybody. We really look at you and your body and where the fat is and decide how to put those tips on. And then here's some some patients as well. So you can get really great results with those little just pouches of fat that you just can't get rid of. It can be a great option. Like I said, you can do chin. It really, it's a quick and easy treatment to get rid of fat if you're not up for the downtime that comes with liposuction. Inner thighs is a really common one because inner thighs can be very finicky. And Coolsculpting is designed to have a very nice gradient when you put it on. So there's really minimal risks of, irregularities and that kind of stuff. The side saddle, the saddlebags that we, as women deal with a lot. So there's a great specialized tip for that with Coolsculpting that we do a lot of for those outer thighs. And again, waist and flanks, any little pouch. Arms, this is a great easy treatment for arms as well. And that banana roll, so that little pouch of fat right underneath the booty. So that's a very common place that we will Coolsculpt as well. It's a very difficult place to lose weight for a lot of people. And here's some more. So this is just kind of our drawings of how we put the tips as well. So this is an abdomen that we did. Side view. Again, it had some really nice flattening of that lower abdomen. You can see less of that projection. Clothes fit a lot better. Neck, again, one of my favorite ones. Underneath that chin. A lot of men do this one because they don't want the downtime as well. So it's a great treatment for guys. Okay, so so we're going to go through both of them, just advantages and disadvantages, kind of little recap. So with liposuction, advantages are ability to remove large or small little packets of fat from anywhere as long as we can get to it. Immediate results for the most part. Fat is removed in a single treatment. More dramatic results often. You can kind of sculpt it a little bit more, and you can be more aggressive as well. Disadvantages, obviously, the recovery time. So 1 to 2 weeks before returning to normal daily activities, delayed swelling, that first few days where you're in a decent amount of pain and drainage. Of course, there's possible surgical risks, although they're rare, and then potential for post-procedure skin irregularities, as with any treatment. With Coolsculpting, advantages, non-invasive procedure, there's no surgery, there's no downtime other than being a little sore, no restrictions, which is really nice, and it's ideal for addressing those small little bulges and areas you just can't get rid of. Disadvantages, often it will require multiple treatment sessions. Results can be less dramatic than liposuction in a session, but if you do, the required amount of sessions, you can get just as good of results. And then again, sometimes we're limited by that applicator itself. Okay, should we pause for questions?
We did have a couple questions come in. Would you like me to go ahead and read those to you? All right, so the first one is Smartlipo a standalone procedure or is it only an add-on to traditional lipo?
So you can do either. So Smartlipo, well, good question. So the laser part itself, so when you say smart liposuction, we kind of think of it as being both. So Smartlipo with just the laser. There are some reports and some people that will do just like a skin tightening procedure or laser to try to like help out cellulite, that kind of stuff, and not actually then remove fat. So there are a few little finesse things that we can do with that without actually removing the fat. It's a good question.
And then second question, what happens after either procedure if you end up gaining weight? Where does new fat appear?
Oh, so good question. A lot of people do think of that. They say, all right, I'm gonna, we're gonna get rid of fat in this area. Am I just gonna gain fat in other areas? So your body doesn't compensate, but and it won't just gain weight in other areas. But I think what happens if you do gain weight, because you have a fewer percentage of fat cells in the area that we permanently removed the fat, you're going to notice it in other areas first. So all of your fat will expand, but you're going to notice it less in areas that you have less cells.
Those are the only two questions that I got.
Perfect.
Anyone else has questions, please feel free to throw them in.
Yes. All right. So setting yourself up for success for either of these procedures. So lymphatic massage is an amazing tool. So with any procedure, whether it's smart liposuction, or Coolsculpting, this will help your body smooth itself, drain more easily, and remove that fat at a faster rate. So typically, we recommend lymphatic massage about 2 weeks after smart liposuction. You can do it a little bit earlier with Coolsculpting if you're not super sore. Everyone's a little bit different, but typically 1 a week for a while can really get things to heal a lot more rapidly and really smooth out your results. So we highly recommend this. There are some products that are known to help as well. So this one on the left, Elastin's Repair, is fantastic. So it's one of the few products that actually will start removing old collagen up to a few weeks before the procedure. So I usually say start this product about 3 weeks prior to your procedure. And then it also helps gain and form new collagen after. So this is a wonderful skin tightening product to use before and after treatment. I would bathe myself in it if I could. I do like certain supplements. I think CBD is a great supplement, obviously CBD without THC, because it's great for inflammation, it's great for healing, it's great for anxiety, and it can really set yourself up for success before and after as well. People always ask about collagen powder. I think the verdict's still out on it. Anecdotally, some people say it's wonderful for my skin, health and that kind of thing. And other people say it just keeps me regular. So I haven't seen any great research on it yet for this type of stuff. But if I was going to recommend one, I do like Nutrafol's collagen because they do medical grade for a lot of things. So. All right, so on to the elephant in the room. Well, I guess, did we get a couple more questions, Devin, or should we keep going?
We did get a couple more questions. One question, I don't know if you're wanting to answer this now or at the end, but it's the cost difference between Smartlipo and Coolsculpting.
Okay. Yeah, we can go through at the end, or that also. When Devin, who's my wonderful consultant, if you do come in and see us, she can give you the price difference for both.
And then I have a few questions here. The next one, does treating the banana roll with Coolsculpting remove cellulite?
Cellulite's very difficult because what cellulite is it's fibrous bands that are actually pulling at the fat. So while some people do notice a little bit of smoothing of that with Coolsculpting, it's not designed to quote unquote treat cellulite.
Another question here, if a person is fairly physically active but have those problem spots they dislike, do you prefer one method of these over another?
It's a tough question. I think if you have very small problem spots and you're a super active person that is not going to sit down for a while after a procedure, then I would probably lean towards Coolsculpting. But if you're someone that's like, you know what, I can take a couple weeks off and then take it back slowly, then liposuction is a wonderful way because you can kind of sculpt certain areas a little bit more and feather them into the rest of you. But honestly, both of them are really good options.
And then last question I have here, not comparing advantages and disadvantages, is either treatment better for the double chin? Which one would give you better results for chin?
It's really difficult because I feel like chin is a tough area because when you're looking at yourself from the side and you have both skin laxity and fat, sometimes removing that fat will not change the skin laxity like you want it to. So the best bet on that is to add that smart laser in there because that gives you the best skin tightening potential, I think. If you're like, I just have this pouch, it's only right here, I think both lipo and Coolsculpting are pretty darn equal. But if you've got fat here, fat on the sides, or a lot of extra skin, I think you want to go for liposuction. And honestly, on the neck, it's a very surprisingly easy recovery.
Perfect. Those are all the questions I have.
Perfect. All right. So the elephant in the room. Everyone's already skinny. What are we doing? So we're talking about the GLP-1. So these are medications that people have been taking originally for diabetes. Some of them are approved now for actual weight loss, but obviously when these medications started, people noticed that they had much less appetite and were losing a lot of weight. So they have started to become very popular for just weight loss. We do the skinny shot here at Westlake Dermatology. I offer it to my patients. So if that's something that you're interested in, we absolutely can see you for that as well. What they do is that they slow your gastric emptying, which means that things move more slowly through your system, so you get fuller faster. It also triggers hormones in your body to actually tell you that you're fuller before you even eat. So those, along with probably many other mechanisms, help you lose weight over time. And so, but what they don't do is that they don't make you lose fat permanently. So you're losing weight like you would on diet, exercise, that kind of thing. So you're shrinking those fat cells. Also with these methods, so if you're not staying active and if you're not eating a good diet, you're going to lose your muscle, you're going to get saggy skin, and that kind of stuff. So there's still huge advantages to doing permanent fat removal to lose weight. And it's not like you have to do one or the other. So in my mind, there's no data on this, but if you are, let's say, losing weight and you're getting to a point where you're at a healthy weight for yourself, you feel good about it, is that the time then to do permanent fat removal? Possibly. So I think if you have areas where your fat has shrunken down and you want to get that removed, it's going to be a lot easier to remove more fat per area because your fat cells are smaller than when they're very, very when they're enlarged and you're overweight. So it actually could be even more beneficial to do this after you've done the skinny shot for a while. But again, the only two ways to permanently remove that fat is Coolsculpting or liposuction. The GLP-1s will help you lose weight, but it's still in there. So if you go off of it and gain weight, it's going to come right back. Let's see. And like I said, we don't know long-term about these medications yet. As we go, we're learning more and more potential side effects, but no big safety signals yet, which is really good. So they do seem like they're safe and a great way to help people lose weight, but again, not permanent. Okay. Any other questions pop up?
I did get one more question. How many treatments of Coolsculpting are usually needed for the chin?
So for the chin, typically you can do it usually in one. If you do have some fat along the side of your chin, we can sometimes stack one here and one here the same day, and so you get this area twice, but also can get the sides. Every once in a while we'll do it once, and then we'll do it again in a few months. But I've never ever had to do it more than twice.
And then what do you like better for underarm fat?
I'm assuming you're meaning under here. So honestly, they're both great. It responds really, really nicely to Coolsculpting, because typically your arm is the perfect length for one of those tips that just is gradiented out. So it's actually one of my favorite places to do Coolsculpting, under here and inner thighs. But obviously lipo is beautiful there as well. If you're meaning more under the arms, like the little folds beforehand, we can do either. We often put the little chin tip right there for your the axillary folds, your little armpit fat. But obviously lipo is really easy to do there also.
All right, and then a few more came in. Can consultations be done via telehealth for out-of-town patients?
Devin, you might be able to answer that better, but I think we can do telehealth. I know it's harder, it's easier in person, but absolutely we can do telehealth for out-of-town patients.
And then is the patient asleep during the Smartlipo?
So you're not asleep under general anesthesia. A lot of people, we give you guys relaxing medicine and pain medicine. So some people come in and sleep through the whole thing. Some people are just kind of groggy and awake. but we keep you comfortable no matter what, but you're not under general anesthesia.
Is the area painful after Coolsculpting?
It is definitely it feels like you kind of got punched there. So it's sore. It's almost like if you touch it, it feels like bruised. And you still have your numbness for a couple of weeks after. But it's not, I don't want to say it's not painful. But it's definitely tender.
That's all I'm seeing right now, unless
Wonderful.
anyone wants to get some last minute questions in.
All right, guys. Well, thank you for joining. So if you are interested in any of this, your next steps are make an appointment with us. So Devin is one of the fantastic consultants down here at South Austin. You can do it online at westlakedermatology.com/book online, or you can call our office. That's the phone number. Again, we're in the South Austin Westlake Dermatology office on Davis Lane. And if you mention you watched this webinar, you receive some extra discounts. So these are the discounts listed here. And like I said, when you're with Devin, she can go through and price everything out. Typically, Coolsculpting tips per tip start at $800. We often have specials on those, and we'll have specials again if you do want to end up with doing Coolsculpting. But we can price that out and compare liposuction versus Coolsculpting for you anytime. So. We'll have discounts on specialized areas, so arms and neck are often priced differently, but we'll have discounts on those as well. And then if you are interested in a skinny shop, happy to see you for that, and we'll have discounts on that for you. All right, guys. Well, you know where to find us. If you have any questions or anything else, please give us a call, send us an email, and hopefully we'll see you all soon. So thank you so much for joining in. Have a wonderful rest of your Friday. Thank you, Devin.
Thank you.
See you next week. Bye, guys.
Bye.